Can COPD be prevented? COPD, to some extent, it's a reversible condition, especially when it is diagnosed in early phases. And can avoid the exposure to the irritants, airway irritants, like when you are a smoker, quit smoking. When you are exposing to the workplace chemical fumes, and also continuous dust exposure when you are exposing to biomass fuels. When you stop exposure to all those irritants, then it is reversible to some extent. But COPD is not completely reversible when it is diagnosed in the later phases of disease. Is COPD contagious? No, COPD is not contagious. But when COPD is associated with lung infections or upper airway infections, cold, then infection is contagious, but COPD is not contagious. What are the early signs of COPD? So, COPD early signs are recurrent cough, with or without sputum, or with or without associated with fever or cold. And also, breathing difficulty when you are walking for long distance, or when you are taking ramps, when you are climbing stairs, when you are lifting weight, you will feel breathing difficulty with or without wheezing, and also loss of easy fatigability, loss of weight, loss of muscle mass. These are all early signs of COPD. Can COPD be prevented? Yes, COPD can be prevented with the following preventive measures, especially when you are a smoker. Quit smoking immediately. It's never too late, because smoking is the leading cause of COPD. And also, when you are exposing to airway irritants continuously, like dust, air pollution, chemical fumes, or other biomass fuels, stop exposure to airway irritants. In this way, you can prevent development of COPD, and maintain good diet, healthy diet, and do physical activity regularly, and get vaccinated with the flu and pneumococcal vaccine. In this way, you can prevent COPD. Treatment options available for COPD. So once COPD is diagnosed with the PFT test, pulmonary function test, it also gives options for severity grading, like mild, moderate, and severe. So based on the severity, the pulmonologist suggests the proper treatment options for you. So but most important is, if you are smoking, quit smoking immediately and avoid exposure to airway irritants. And the medicines available are, most common and most important medicines available are inhalers, inhaled medicine, which dilates your airways, which reduces the swelling inside your airways. In that way, they relieve the symptoms, and also they stop the progression of the disease. And in COPD patients, when oxygen levels are too low, then oxygen therapy, home oxygen, also relieves the symptoms, and it is a part of therapy. And also preventing infections, because the infections, lung infections, causes further worsening of COPD and also causes deaths in COPD patients. So get vaccinated with flu and other pneumococcal vaccines, and definitely improve your diet, and get checkup regularly with your pulmonologist. And if there is history of COPD in the family, then get regular checkups with pulmonologist with PFT test. In this way, we can treat COPD effectively. Thank you.